This is a 3D presentation of a botulinum neurotoxin molecule. It's known as one of the deadliest substances on Earth of extremely low lethal dose. Its heavy chain uses its cell binding domain to target at connections between neurons and muscle fibers, which are known as neuromuscular junctions, and then enter into the cell via synaptic vesicles. Later, the translocation domain inserts into the membrane and releases the light chain, which eventually blocks the neurotransmission and causes paralysis. However, it's also known as a choice for cosmetic surgery with trade names such as Botox and Dysport. It can improve the pliability and elasticity of the skin and reduce wrinkles, thereby it can reduce the perception of age. But the mechanism is not well understood. My research focuses on cellular targets of bones with bioinformatic tools, which may help explain those effects. The first step is built upon literature research. There are over 40 different subtypes of bones have been identified and classified into 8 cellular types. All the subtypes share the same modular compositions as previously demonstrated. By far, one type of glycolipids and 2 types of neuroproteins have been identified as its target. This table includes most discoveries of the receptors, but a recent study reveals that fibroblast growth factor receptor, a type of growth factor receptor that is important for synapse formation, may also be a receptor for bones, or at least for bone A1. This discovery, in addition to the prediction for more ganglioside or carbohydrate receptors, breaks the classic dual receptor system. No one knows where and how this works. To find out, sequence and structure alignments are the second step of my research. Sequence of 41 bones and crystal structures of 13 bones have been analyzed. Conserved residues among those bones, especially those on the surface, can be possibly responsible for the binding. Analysis of surface properties such as electrostatic potential and hydrophobicity, combined with those mappings of critical residues identified in previous research, can also be useful. The third step is to predict the binding sites. Multiple services have been used, and the results have been evaluated and summarized as 3 possible sites for FGFR binding, which are then compared with the results in previous steps. Indeed, my research cannot fully answer the question why the deadliest toxin is effective as a cosmetic agent, but it suggests possible directions for the future research of bones. In summary, my research used literature research to identify critical residues that are then mapped into the alignment of sequences and structures and compared with predictions for binding sites. This video can hardly include all the things that I have done, but explains the main process of my research. Thanks for watching.